Hello everyone, I'm Dr. Anthony Cave, a Stanford and Harvard trained anesthesiologist, and I had 3 patients that have wanted me to talk about trauma, addiction, and surgery. And they each had a story that you're going to find fascinating about how our minds work and what's revealed under anesthesia. So I'm going to start by first connecting myself to the EKGs so you can see what's happening in my body as we talk about the link between trauma, addiction, and surgery. And yes, I am holding propofol, the milk of amnesia. And this is just one of the many medications and chemicals that can reveal what's going on inside your body. Willow, good to see you. So first I have to connect these. It comes white right, clouds over grass, the green goes underneath it, and smoke over fire. Smoke is black over red. Okay, so let's get started now. And by the way, I see the comment on ketamine. That's fantastic that it was so life-changing for you. So now I'm connected to the monitors here, and you're going to see my EKG come on in a moment. And what did these patients do? What were their stories that were so revealing about them under anesthesia? And actually, before they came in the room, Linda, Chris, Donna, good to see you. So the first is a patient has a history of addiction to fentanyl, which, by the way, I have right here in my hand. This is a vial of fentanyl. It might be hard to see with the fuzzy, but you understand that patients that have had opioid use disorder often come to me in the operating room here, and they don't want a drop of fentanyl. They specifically say, "Doc, I don't want any opioid at all," because of what it might trigger in their brain even when they're under anesthesia. They can tell if there's been a little bit of opioid when they wake up, and that can trigger potentially the addiction cycle to start again. Patient walked in and with so much conviction told me they didn't want a drop of fentanyl with their anesthetic, even though they knew that there might be pain and they were totally okay with the pain. Another patient walked into an operating room just like this one and walked right back out. They knew they needed surgery, and they had taken time off for their surgery, time off from work, had a whole recovery planned off of work as well, financial hit, of course, personal challenges, etc., to make that happen, and they turned right back around because of the trigger, not of fentanyl this time, but the trigger that just seeing the lights in the operating room caused in them. And the third patient, when they got the anesthesia mask on their face, immediately went into a panic attack on the operating room table, triggered by the smell of the plastic mask. 3 triggers: fentanyl, something visual like lights, and a smell trigger, all caused a dramatic response in 3 different people. Isn't that incredible? Because they didn't actually get anything injected into their body. The first patient didn't get fentanyl. The second patient just saw the lights. And the third patient just smelled something. No propofol, no fentanyl, no anesthesia gases went into their bodies. Yet this concept that I'm going to tell you about, it's called neurons that fire together, wire together. And what does that mean? And what does anesthesia do to break? And ketamine specifically, how does that break this wiring and firing together? So let me just back up and tell you that I heard this first when I was an undergrad at Berkeley. And by the way, I'll tell you what the EKG is for. It's me on the EKG once again. And I'm just going to demonstrate for you this firing and wiring together pattern, because I didn't understand it at all, because I think it was explained in a very overly complicated way that I want to break down for you. I was in a neuroscience class at UC Berkeley. I had to do some requirement for med school. Remember, I was an engineer at first. I didn't take any biology classes. I didn't like biology at all. And I still don't like biology sometimes because it's made to be overly complicated, and very simple concepts are made way too complicated to the point that I couldn't understand as an engineer because they were using specific words that were convoluted, and it really bothered me. This concept I want to break down for you because it's so easy and so powerful, yet so convoluted. Neurons that fire together wire together. This was talking about the phenomena of neuroplasticity, or the phenomena of Bottom line, we are creatures of habit. You, me, the patient that walked in, the fentanyl addicted patient, and the patient who was triggered by the smell of the anesthesia are all creatures of habit, meaning that behaviors get reinforced the more that we bring them up. So in the case of fentanyl or alcohol, well, the more you use fentanyl, the more addicted to it you get. There's no question about that, right? The dopamine rushes and the withdrawals reinforce a cycle. Well, yeah, neurons that fire together, you see the fentanyl, you experience the fentanyl, the dopamine rush, put together around the same time makes that connection strong. Well, how about the patient that walked in? They had a history of medical PTSD. They had had a loved one have a challenging, harrowing experience in an ICU, and just the sight of the lights triggered that, because every time they went into the hospital for their loved one, what happened? Those emotions of fear of loss, uncertainty about their loved one's future, doubts about the medical care they might receive, kept being reinforced every single time. Neurons that fired together, so they see lights, triggers emotions, and they see more lights, trigger more emotions, and back and forth. What is happening? You're reinforcing, right? Neurons that fire together, wire together. The last example I gave you of the smell of the plastic in the mask. What happened? Every single time this individual had had multiple surgeries since childhood, what happened? Every time they smelled that, they knew they were going to wake up in pain. They knew, or they were going to lose control. They knew they were going to have a complicated course in a hospital. As a child, led to adverse childhood experiences, what we call ACEs. Once again, creatures of habit, neurons that fire together. The smell became in their brain linked with that feeling. Smell became a trigger. Now, there's so many more examples of this, right? Addictions are the easy ones, but just seeing things and smelling things, like we said, when you think about trauma and PTSD, we don't need to be given a medication to have a panic attack. So why am I connected to the monitor? Because I'm going to show you how, based on what I'm thinking and how I'm breathing, my heart rate's going to change. It's just one of the many examples of ways that our mind connects to the rest of our body, reveals itself when you're even under anesthesia. So let us get a little bit closer, and I'm going to tell you then how ketamine breaks this cycle and why neuroplasticity can help break these neurons that are habitually stuck in patterns of constantly firing together. These become habits. When we say that we're creatures of habit, this is all this firing and wiring together means. We are creatures of habit. And I'm going to show you how that displays how that shows up when you're under anesthesia, hopefully without knocking off my phone here. So I'm putting a pulse ox on my finger so you see my EKG and my pulse ox. I'm going to bring this close here. Now you guys tell me, what do you want me to think about? Give me a scary thought. And Carrie says, I only need a double dose of Versed. Well, that can help be a Band-Aid. It's not going to solve the underlying problem the way that ketamine does. And I'm going to tell you in a moment how ketamine is unique compared to propofol, Versed, etc., and its ability to help break what's going on. So Blue Omega wants me to think about alien movies. I'll tell you, when I was a child, there's this movie called E.T., Extraterrestrial, I think, terrified me. I absolutely despised E.T. Predator and Alien, whatever, I didn't care about those, but E.T. terrified me. And I distinctly remember a particular scene that I'm going to play back in my mind right now, and you're going to hear how my heart rate changes, how my heart rate variability changes, and how it was terrifying. I'm going to relive the memory. I'm going to reinforce the trauma right now by telling you about it. It's like a reverse exposure therapy. There was a scene of this white alien in the bottom of a ditch, and I think they'd been in a refrigerator earlier. They were all ghostly appearing, and it was, I was terrified. I couldn't walk down the hall without looking over my shoulder in the dark, I remember as a kid, because I was afraid this little alien would pop up. All right, enough of me storytelling. Charles already noticed, and Blue Omega said the huge eyes. These all terrified me. I really got nervous and scared, and boom, my heart rate went up. You guys might think E.T. is just an adorable little cartoon alien, whatever. I didn't think so, to be very clear. Every time we relive that, you hear it, what's going on now. Now, Charles wants me to do vagal, and I can do vagal, and I will in a moment. But you all saw and heard, as I went through, what happened to my heart rate variability. The heart rate itself need not change tremendously, but the heart rate variability went down. And this is obviously not super dramatic because I'm talking to you, there's 50 some odd people on here at the same time, there's multiple factors. But the more I relive this, the stronger I make that connection. Now, what happens when you are giving ketamine or a beta blocker in the middle of this same exercise? Now, I'm not going to inject myself with propofol or ketamine or a beta blocker right now live. That wouldn't be that wouldn't be a good way of doing this, right? But I am going to do a vagal maneuver, like Chris said, that Charles said. And this demonstrates how, through what we believe this neuroplasticity, can help us break these cycles of trigger behavior, trigger behavior, trigger behavior. Neuroplasticity, because when we intervene on what happens, let's say with ketamine, we believe, for neurogenesis, new synapse formations in areas that had abnormal memories, for example, unconsolidated traumas from the past. Whether it be ketamine, the fentanyl, the OR lights, or the anesthesia plastic mask. When we can intervene in that moment when the body is responding, like my heart rate went up, we believe that we're influencing nerves to no longer fire the same way together. If you're giving ketamine, you're chemically altering it. If you're giving a beta blocker, you're chemically altering it. But I can talk about the same thing about ET and do a vagal maneuver and similarly attenuate my body's sympathetic response in giving that story. And I can do that most powerfully. I've done the carotid massage. You've seen me do that before. You've seen me bring my legs up in the air. You've seen me do an ice bucket challenge. But I can do it with just breathing. Just like Charles said, mindfulness. When we are masters of our attention and we choose to focus, perhaps less so on the elements of the past trauma that we can't control, but that instead focus on the elements that we can control. I'm not saying it's easy. I'm not saying that PTSD is a trivial thing to overcome. Absolutely not. But the power of attention is one of the foundational ways that we, as you heard with your own ears and saw with your own eyes on me connected to this monitor. Now, I'm not saying ET is commensurate to a trauma of a combat veteran, losing a loved one, any number of traumas, sexual abuse, rape, etc. But in this small example, even in front of you, I've shown that I can make this, I can break whatever loop this was for me. Now, I'm not going to give you other traumatic examples. I have had one, and I'll tell you for the first time, I have had one, and it helped me connect with patients so much more, because the loop for me was that every time I walked by the store in San Francisco where this traumatic experience happened to me, I felt exactly what my patients have been telling me for years. And it was miserable. And it was a loop, because every time I walked by, every time I thought about what I did, I had feelings of guilt. I thought, oh, I should have spoken up for myself. Every time something on my body reminded me of that experience, I felt guilt and shame. Why didn't I speak up? It became a trigger. Not only walking by the store, but then what I saw in myself. And sure enough, everything you saw here came up. Far more intense than the ET example. And it helped a lot so that I could understand where my patients were coming from. I will say that I've been fortunate to be able to overcome a lot of this. And I did it in large part with the idea of intervening on the body's response. Every time I started to go into that loop, my body would act up like this, I would try to break it. I didn't use ketamine on myself. No, I didn't use any anesthetics, but I did use the power of attention to focus on what I can control, which is my parasympathetic tone. And I do believe that helped me, in addition to the support of loved ones, in addition to speaking up against the city about what happened to me that time, but without going into more details about myself. I tried to do everything I could to break the cycle every time it was going to start. Neurons fire together, they wire together. Wiring means they literally connect in ways. And I wanted to break that connection. And I'm very happy to say that it's helped me a lot. With that said, there's so many people that had comments, and we'll talk more about this in other lives as well, but I wanted to ask a little bit. Answer a few of your questions. Sushila is asking, my legs in the air. Yes, you've seen me when I raise my legs, my heart rate goes down. As the blood rushes back, the venous return increases, and the blood to the heart, increased blood return to the heart allows for a decreased heart rate to be tolerated. And Blue Omega comments on how much the breathing helped with their anxiety. And Blue Omega, that's fantastic to hear, because we strongly believe that it's not only our breathing that influences our anxiety, like when we are rapid, shallow breathing, we're making ourselves more anxious, but also that our anxiety impacts our breathing patterns. So it's bidirectional, so it gives us a powerful tool to be able to connect between the physical and mind, the physical and psychological state. Hey, by the way, if you guys appreciate me doing live demos on myself and hearing what's going on in my body, I'd appreciate it if you hit that like button. Of course, share what you've learned with others so that you can appreciate how much power you have yourself to take control of your health. Be an advocate for yourself. Empower yourself. Because doctors can help you along the way, but we can never do what you are capable of doing. Of course, you know what, there are some examples. You can't, everyone always says, oh, I willed my bones into fusing themselves. You know, of course, if there's an emergency, doctors can do amazing, powerful things. But the majority of chronic conditions, they fall outside of that. And you have incredible power, just like I demonstrated on myself. It might take time, but you have that potential. And I'd love if you could share that with others. Let's answer a couple more questions. And Heidi is talking about white coat hypertension. Well, white coat hypertension is just one example. Not only does your blood pressure go up, but your heart rate can go up as well. Chris says, I'm afraid of the meds for my upcoming surgery. To be honest, I'm a bit afraid the timeout is going to be a major trigger. And Chris, this is why the timeout, another powerful, powerful trigger. He's referring to what happens in the operating room when, before you go under anesthesia, we do a timeout. We ask you your name, your allergies, talk about a fire risk score, a couple other things. This is potentially triggering for individuals like Chris. What are ways that you can intervene in the moment? One, you can do breathing exercises. Two, you can ask for a little bit of esmolol, for a beta blocker, to attenuate that response. Using midazolam is problematic because midazolam will wipe your memories. So you'll be calm in the moment, but you may not have integrated that experience with the rest of your memories. It's just going to be like a goldfish. You felt okay in the moment and that's it. You won't be able to take that with you, which is why ketamine is different than propofol. Ketamine allows you to remember the experience and take it with you. Same for mushrooms, potentially laughing gas, nitrous oxide. This is the power of intervening to prevent neurons that fire together to wire together so that we don't become creatures of habit, enslaved to our past habits. Of course, it's more complicated than that for many patients. But for many patients, it's not all that much more complicated. And we can begin to identify our habit loops that end up hurting us in the long run and being able to act on them every single time to understand that very, very basic principle that they tried to teach me whatever, like 20 years ago. I didn't understand what they were trying to say. I hope you understand that today. Thank you all for your support. Once again, if you did learn something, do please share with others. Vivian, I am wishing you the best for your knee replacement. Do check out my videos on how to attain a state of peace and calm before surgery. I hope it'll help you. And Jessica, absolutely, I'm so happy that you also appreciate the power of us being able to break cycles We have to be aware of them. And that's why mindfulness, which is defined as non-judgmental awareness, is the single, perhaps most powerful technique we can incorporate into our daily lives to observe and be aware of what is happening in our bodies so that we can act on it before those actions take over our bodies and our mind. Non-judgmental awareness. That's all mindfulness is. And the more non-judgmental awareness we have, even like Vivian right now telling me that she's afraid of her knee arthroplasty. What is the trigger? Can we be aware of what it's doing to our body? And can we act on it to prevent those nerves and neurons from firing together more, prevent them from making more of a habit loop so that we ultimately don't become a creature of habit enslaved to that loop. Until next time, remember that you have more power over your health than you've probably ever been told.